People of Reddit that work in an insane asylum, what is the craziest story you have? Not me, but my dad. He worked in one for about a year, and one of the patients there always threatened to kill my dad if he saw him on the other side. Many years later my dad ran into the man at Disneyland. Luckily the man was on longer insane and did not try to murder my dad, but instead thanked my dad for helping him. Till the other side is Disneyland. Not bad. Many decades ago, my mother's friend had a severely incapacitated adult child in a mental home. He always complained that the orderlies were out to get him, but his parents dismissed his complaints because, well, he was crazy. Turns out the son died and the autopsy found dirt in his lungs. An investigation followed, and he was killed when an orderly restrained him by pushing his face into a potted plant, and he sucked dirt into his lungs as he was suffocating. His father wrote a letter to a local paper in which he libeled the shit out of the mental home. They sued him, he lost everything, and he committed suicide within days of the verdict. His wife died years later alone. I worked at a hospital, an inpatient psychiatric hospital. There was this boy, I think he was about 15. He originally came to our hospital in the wintertime. He had been aggressive and really depressed, but other than that, he was your average teen. A couple months later he was rehospitalized. This time, he had a completely different presentation. His affect was all wrong. He was cold, distant, and he hardly remembered me. One night, after I had gone home, he went to use the bathroom. After being in there for like 20 minutes, the staff went looking for him. With some verbal prodding, he reluctantly opened the door to the bathroom. There he stood, completely nude, save for the feces, which painted him from head to toe. Oh, and the 2 payday-sized turds he ferociously gripped in each hand. He then gestured all Matrix style to the staff, with a sort of a Neo/Morpheus come-hither gesture. The staff donned the hazard suits and then bull-charged him. He had smeared poop all over the walls. And in the light switch. They sedated and restrained him that night. When I came in the next day, the nurses told me what had happened. I went to go check in on him, since I had previously established a relationship and real rapport with him. He proceeded to ask me if I had ever been raped, had sex with a man, or seen God. Yeah. That was when I really understood the power of psychosis. And I now have more empathy, understanding, and respect for all of my majorly mentally ill clients. Edit. 2, TLDR, working at a hospital, meet a kid, he's cool. 2 months later, comes back, very different. One night, smears poop all over the walls / himself. Staff dons hazmat suits, tackles the kid, as he swings poop at them. Next day, he is religious, and asked me about being sodomized. Edit. I'm not sure if the people voicing complaints work in the mental health field, because if you don't, there is something you should know. The work? Helping people, carrying pain, hearing terrible stories, being responsible for someone's life, it wears on you. So, we each have a funny story, or an interesting one. I love my clients. And, I help people. But, I am also human. I self-deprecate in my sessions all the time. Humor is a healthy coping mechanism. So, if the stories make you uncomfortable, stop reading them. For everyone else, please take something from these stories. Appreciate what you have. And be kind to those you don't understand. You never know what they're going through. Edit 3, I really appreciate all of the love, and gold, whoa. But, what I'd really like, is that everyone takes a minute to remember that we all have our stuff. No one is perfect. We all struggle, we all have pain, scars, and some self-hatred. So, when you see someone talking to themselves, when you hear about a teenage girl, just doing it for attention, or a guy, drinking himself to death, just remember, that could be any of us. We're all in this together. So have some empathy, and don't let that little voice inside your head jump to classify someone as something. Let's just all be. Agreed? Thank you, I'm out. Drops microphone. Guy in his early 30s who was a gifted mathematician. Often thought he was Elvis, and would walk around at great speed mumbling to himself, or singing Elvis numbers under his breath. Totally burned out by his own mind. A social group of heroin addicts who variously got admitted due to the psychiatric consequences of AIDS. Only one of them was HIV negative, and he would come to visit their friends. The reason why he was negative? His dad was diabetic, so he obtained and got first use of the needle. In the past year, A man with severe schizophrenia and a degenerative spine clearing a 3 to 4 foot counter just to sit on the floor in the middle of the nursing station because Arthur Salad and the Supreme Being told me to. Same guy trying to bite off his own fingers because we wouldn't let him climb the counter, so he needed to appease Arthur some other way. Having to remove plastic cups from the adolescent unit because one of the worst borderline girls I've ever worked with kept trying to cut herself with them. A bipolar patient presenting with psychotic features accusing me of being Cthulhu trying to steal his soul. Later became his favorite staff member after the mania. Schizophrenic 13-year-old that looked like Chucky. For real, that was the nickname staff gave her. Her parents didn't believe in medication, so I got to watch her laugh manically and respond to non-existent stimuli for extended periods of time. Not mine, but my mother worked in a mental hospital as a nurse shortly after receiving her degree. One of the patients to which she attended was a large black man. She asked him one day how he was doing, and he responded, "Sometimes voices tell me to kill white women." To which she responded, "Are they talking to you now?" R.I.P. The Gaby's mom. I did medical clearances for a psych ward at a county ER in Sonoma County, California. I worked there for a year and a half. One time we had a guy who went on a meth bender for days on end and did nothing but play World of Warcraft during this days-long bender. He was also schizophrenic or something. I can't remember what the nurse said. Anyway, he was living in the video game. Screaming about Azeroth Act. Thought the nurses were bad guys. We had to restrain him. Another good one was a woman who came into the ER to say she was suicidal. She saw the line and went back out to her car and committed suicide by taking a bunch of pills. A few days later her sister turned up looking for her. I found her dead in the back of her car. No one had noticed. After a long time in places like this you do become desensitized. Sorry if I sound callous. Story from a friend, a doctor, not an insane asylum worker. Gender and some details may or may not have been changed for patient confidentiality. A woman was admitted to the hospital at 2 a.m. after calling police and telling them that she had overdosed on some medications. Upon first examination, she was fine, but she wouldn't tell physicians or nurses at the hospital what she had taken, and they were concerned there might have been some acetaminophen, which can cause liver failure, so they wanted to hold her until they could perform some test. Apparently this woman was a frequent flyer, probably homeless, a history of self-harm behavior. This particular instance, someone missed the self-harming part, and this patient was left alone and unrestrained at some point for 5 to 10 minutes. In that time she managed to swallow several razor blades and needles, all sterile, luckily, a fact which she gladly informed hospital staff of a few hours later. QGI surgery, the service my friend was on, and a whole heck of a mess. Notably during the surgery, one of the surgical nurses who was palpating the small intestine for any missed blockage, debris after the surgery, but before closing, ended up cutting her hand through the patient's small intestine, when she closed her hand on an unaccounted for razor blade. Not a pleasant experience for anyone. Patient survived and was fine, but apparently wasn't even committed, just placed on a hold. Public funding for mental health is really low, so there isn't really a place for people like this if they are destitute, homeless and are generally lucid, but with some problematic behaviors. Edit? Oh, and the kicker was that she probably hadn't even taken anything. The test for acetaminophen came back negative, at least, just wanted to spend the night in the hospital, and then decided to eat some razor blades. My dad has worked in a special needs prison for about 15 years. He has seen cannibalism, self-castration and manipulation just for medical attention. More shit thrown and smeared than a zoo. You're really gonna leave us there? I met a woman who started out pretty normal, if not a little bit loud. We were watching Skyfall and she leans over and starts telling me that she's pregnant. I'm a little confused, but I ask her about it and she says that it's in her back. I told her I didn't think it went like that and she replied that her real baby was in her back, and then went back to watching the movie. 15 minutes later she leans over again and tells me that someone ripped all of her waist-length hair out. Then she told me they sealed her hair inside of the braids on her hair, and the hair could only be unknotted if I got her 2 black hair bands from the house. Her hair was braided, but it was probably only 5 inches long and scrappy. She was quiet again for a while, before she started staring at me. She asked me if I was the one who ripped her hair out. When I immediately said no. She looked at me for another moment before asking again. When I reassured her, she nodded and sat back, saying that I should tell her doctor that she was hearing the voices again. Not an insane asylum, but I frequently visit the Alzheimer's ward of a nursing home, which is close enough. First, you have to know that they put everyone into a big room to eat with about 4 people at each table. I am also a male, which is important to the story. I was feeding one of the women there and the woman across the table kept talking to me, which was normal. Alzheimer's patients are usually able to carry on a conversation until they are in the late stages, and this woman was in her early stages and still physically healthy. She kept complimenting me on how handsome I was, which is for sure a sign of a mental disability. I have one fat ugly mug. She also kept offering me a piece of her pimento cheese sandwich. I kept refusing and saying no thank you to her offers. Apparently, she wouldn't take no for an answer. I don't remember exactly what she said, but it was along the lines of "I'm going to feed this to you now." She got up and sprinted toward me trying to grab me and force the pimento cheese sandwich in my mouth. Luckily, the Caribbean nurse assistants were able to grab her and say things like, "No. This is my husband. You can't do that." For anyone who has never been into a nursing home, the nurse assistants are always Caribbean. It's a lot like Gullah Gullah Island, except more depressing. I darted for the hallway and left as soon as I could that day. I know it's kind of petty, but it was one of the scarier moments of my life. Also, there is the woman who screams, "Oh Lord Jesus. My tits. My titties hurt." TLDR, I was almost sexually assaulted by a horny female Alzheimer's patient with a pimento cheese sandwich. My grandmother used to work at an asylum, and she told me this story. It was one of her first days there, and she was just making the rounds. She came across a patient who was repeatedly banging his head against a wall. She asked him why he was doing it, and he replied, "Because it will feel good when I stop." I'm kind of scared that makes so much sense to me. Skeptical. It makes sense because it's true. Endorphins are a hell of a drug. Not me, but my mom, who used to work as a phlebotomist, SP? Medical bloodsucker, at a hospital with a psych ward. Come Halloween, they were told that all nurses were required to wear costumes, whether they wanted to or not. One of the patients started talking about seeing a giant bunny wandering around the ward. The doctors were getting worried about the guy, and were getting ready to up the dosage of his meds. As they were getting ready to administer the new drugs, one of the nurses walked up, dressed like a rabbit. No one, especially those going into the psych ward, were required to dress up anymore. My best friend's grandma used to be an orderly. She told me the following story. Patient is sent to the mental hospital for murdering someone, but he was criminally insane. Fast forward a year, she knows him pretty well and he is a generally nice person. A few months later, his mom and dad come to visit crazy guy. They bring stuff for a picnic. Bread, meat, cheese, knife, spoons, forks, chips, and other goodies. They are eating for a while in the grass area in front of the hospital, not much attention being paid to them. Orderlies see one of the parents lying on the floor, the other one with the murderer on top of them. He puts the knife down and sits back down. The parents had both their throats slit. She never found out what happened to him. I know it sounds far-fetched, but I will try to see if I can find an article. TLDR, murderer sent to asylum, murders mom and dad when they visit it. I was talking to my best friend's grandma today and she said the kid murdered his grandparents when they were cutting the salami, but I still can't find an article. I worked at a hospital that had a psych unit. One time I had to do an EKG on a 250-pound 60-year-old woman. When you do an EKG, the patient has to open up their top. But this one proceeded to take off her pants too, completely naked. Then looked me in the eyes and asked me, "Roger, my name is not Roger, why did you leave me in, ma? Do you want some of this? Will it make you stay?" Her look still haunts me. Just gave me chills. I don't work at a psychiatric hospital anymore, but I used to work at a large state hospital. A guy on another unit pried his eye partially out with a plastic spork. I did not witness this, but it happened while I worked there. This one guy would pry his turds out with a pen and stack them in geometric sculptures in his room. He also filled his drawer with pee. I once helped this woman get cleaned up in the shower. She came in all covered in shit and piss and vomit. She was there for a few weeks, so I got to know her a little. Then, I myself had a nervous breakdown a few months later and had to be hospitalized. Different hospital. She was in there too, and remembered me, and helped me get used to being on the inside. Was weird. Edit. I have read some comments where people are saying it's stuck up to share this stuff, that it violates confidentiality, etc. As someone who has both worked at and been a patient in psychiatric hospital, I say bullshit. You try working that job. Rewarding? Hell yes. But even when you are no longer there, That shit weighs on you, and it's cathartic to speak of it anonymously on Reddit. No one is acting like it's funny or cute. So chill out. I work in the mental health field in a psych hospital, but I have also been on the receiving end. I think my personal favorite story was when I was admitted my first time. We were all in rec therapy and I was still having a hard time being in the hospital, suicidal ideation, so the social workers asked if we wanted to listen to some music. Lo and behold, Prince's Purple Rain was the album. It was all fun and game until Let's Go Crazy started. We all sat in silence and looked at each other for a good half a minute, then just busted up laughing. Seriously, one of my favorite memories to this day. When I got admitted to a crisis center/mental institution, the weirdest thing I remember was an Asian girl who just started her period went into a frenzy and started smearing everything with it. This happened regularly in my high school bathroom. Just popping in for a piss and then, oh god, what's on the walls? I want to share mine. During nursing school we did a standard psych rotation. Another female classmate and I were in a group session in the men's unit. We sit down and then a violent sexual predator who makes it a point to make any and all females feel like victims, sits down next to me. He proceeds to invade my space and I'm not exactly sure what else he was doing back there because I was attempting to remain focused on the group lead's speech, but he received many verbal warnings about his actions. After a few minutes he interrupts to inform everyone that he needed to take a trip to the bathroom, wink at me and exit the room. At which point a patient on the other side of the room, who has refused to speak to anybody about anything, and up till this point has for all intents and purposes been completely in his own world, gets up. He politely scoots the chair, which had ended up touching me, away from me and sits down in it. He sits for a few seconds and then gets up, grabs his empty chair and throws it into the room across the hall. He sits down again. He received a warning for throwing things and a thank you from me. When the VSP came back and saw no available seat, he decided to go watch TV and wait for the nurse to open the med room. Also, all of the female patients ranging from 17 to 73 were pregnant. There were other things, but I really appreciated the help I received. TLDR, as a student in group another patient intervenes when a violent sexual predator makes me the object of his attention. Edit TLDR. Thanks for listening to another episode of RedditX. Subscribe and activate the notification bell so you won't miss any stories. Feel free to share your own stories below in the comments. Have a good day.